Hi, my name is Veni Chara, and my clinical question is, why do people practice unprotected sex with multiple partners despite the rise in sexually transmitted diseases? And then the contributing concept I found was people say they ruin the moment. Some say pull-out method works just fine. Trust me, this I'm disease-free. Some say I'm allergic to latex and some feel awkward buying them, and some feel uncomfortable just for wearing them. If we can look at this first concept map, it gives like the basic reasons that people give for not wearing condoms, majorly because of ignorance. Some say the religion, especially Muslims. Some say they don't have money to buy it, so poverty. And some say they are immune to the STIs, and some medical enhancements they can do after having sex to stop the STDs. So, despite the rise in sexually transmitted diseases, some people prefer unsafe sex. This clinical question aims to understand why people continue to engage in unprotected sex with several partners, disregarding the possibility of contracting STDs like HIV, gonorrhea, syphilis, chlamydia, and others. Nurses can encounter this problem in their homes, hospitals, and in local communities. This being the worldwide problem, the victims are very many and be found and can be found in many communities. To fight against STDs, nurses can play a very crucial role in educating the public about STIs and promoting healthy sex. That is according to SO 2020. Overall, campaigning of the use of condoms is important to promote sexual health, preventing spread of TIs, and empowering individuals to take control of their own sexuality and safety. Provide some of the strategies I found that are evidence-based to fight the use of condoms include providing a comprehensive sex education that include information on contraception, STI prevention, and communication skills. This can increase the knowledge and reduce the risk behaviors. Also, increasing access to contraceptives, and encouraging open and honest communication about sexual history, STIs, status, and contraception use. And I've found that behavioral interventions such as motivational interviews and cognitive behaviors therapy can promote positive behavioral change and can help individuals develop skills to negotiate safe sex. So to support my clinical question, I chose the theory of reasoned action. The theory of reasoned action aims to explain how behaviors and attitudes relate to one another in human activity. That is according to Vega 2019. It is mostly used to make behavioral predictions about people based on their current attitudes and behavioral intentions. The result that an individual participates in an activity will occur in engaging certain behavior is derived from their decision to do so. The primary purpose of theory of reasoned action is to understand the person's voluntary behavior by looking at the fundamental driving force behind their behavior. According to this theory, a person's desire to engage in behavior is the primary indicator whether or not they do so. In addition, whether or not the individual will actually engage in an activity depends on their normative components. The idea holds that the intention to carry out a particular behavior comes from the actual behavior. The theory of reasoned action is appropriate as a foundation to address my identified clinical problem because it helps in understanding attitudes towards condom usage and perceived societal norms about safer sex, and safer sex intentions is made easier. Theory of reasoned action can help examine patients' instrumental attitudes and instrumental norms regarding condom usage and aid in education strategies to help reduce STIs. According to this concept map, my last concept map, including personality traits, life experiences, and attitudes might affect how they perceive whether adapting particular behavior can result in beneficial health outcomes, and whether or not people can effectively adapt the behavior is also dependent on this theory. These attitudes and subjective norms can impact the intention to engage in certain activities, and eventually these beliefs can influence promotion of change. That is according to AMAC. So this is the map. And in conclusion, I can say that the theory of reasoned action is used as a tool for nurses to understand and predict patients' behavior towards their health. By utilizing this in practice, nurses can develop effective health educational program, assess patients' intentions to change their behavior, use persuasive communication, and evaluate the effectiveness of the intervention. So this is what I can encourage my fellow students to use in practice, and also use other theories that we've learned in this class to best give the best evidence-based care to their patients. Thank you.